Hey, this is Dr. Rupeka from Youthology. I'm going to do a quick video talking about why I think a deeper plane of penis injecting is a better way to inject, why it causes less complications, virtually takes out the risk of migration, usually ends up with a more even result, less nodules, and why that means I can inject somebody that's circumcised versus uncircumcised. So if you think about how a penis looks from the side, anatomically it's mostly made of spongy tissue. Oh, that's a bad penis drawing. And that erectile spongy tissue forms most of the head of our penis and the shaft. Around that are layers of connective tissue. These connective tissue layers end up fusing somewhere up in here, and they fuse back in here as well. As the connective tissue goes back towards the body, it forms more of a muscular layer. And then around all of this, we have our skin. So our skin comes up, it goes around the connective tissue, turns into foreskin, and that's what that would look like in a guy that's not circumcised. Now, if you think about it, when you get an erection and the shaft of the penis is hard, you can move the tissue up and down on that connective tissue very freely. When I inject, I like to place my filler, whether it's PMMA or HA. When I inject, I like to put my filler in a deeper plane under the connective tissue. So what that would look like on this rudimentary drawing is us putting the PMMA filler in this deeper layer of tissue. And we do that by creating the space with our cannula movement, and it locks that tissue, locks that PMMA in place, and there's virtually no risk of it migrating. So when guys ask me about filler migration down into the scrotum or filler migration up into the abdomen, it can't really happen because it doesn't allow it back there. We don't tease that space open enough to where it goes open into a cavity. Also, this enables me to inject guys irrelevant of what the skin looks like on top, because we're not injecting directly under the surface. A lot of other injectors out there, or providers out there, are injecting their product out in here, which is directly under the skin on top of the connective tissue layer. This type of injection is prone to migration this way and this way, and that's why a lot of other providers require that you get circumcised prior to injecting, because they're placing the filler superficially under the skin. Now, if you read comments on Reddit or on fallow boards and guys talk about Dr. Rupeka doesn't inject past the circumcision scar, it's not that I don't inject past the circumcision scar. I only inject as far as these two connective tissue layers will allow me to, because they eventually fuse, and they fuse before the glands. So I'm always going to only inject up until this point of confluence. Now, if somebody's circumcised, most of the time that circumcision scar does coincide with where these two connective tissue layers fuse, and then yes, at that point we would have injected to the circumcision scar. But if guys are circumcised a little lower, then that circumcision scar does artificially fuse those connective tissue layers, and sometimes we're blocked by the new circumcision scar fusing those connective tissue layers, and we can't inject past it. You can inject into this area, but I really wouldn't recommend it initially, because that skin is so thin, it's very friable. Sometimes the cannula pokes through the skin. Other times it just lumps up very easily. So usually for the first 1, 2, possibly even to the third time we're injecting, I'm going to only inject to where these connective tissue layers fuse and then fuse. This also allows me to inject the entire surface area of the penis. So I inject the underside, top side, both sides. We try to inject the whole shaft very evenly. You're still going to want to massage afterwards. You're still going to want to follow all the aftercare, because the better that you can do to get this product to lay down evenly in here over the next 3-5 days after you've been injected, the better it initially gets inflamed, settles, and then people are happier with that result because it's a little bit more even. Like I said, this deeper plate of injecting does allow you to get more even results because of this connective tissue barrier on top of it. Less nodules or lumps. and then it looks more natural. I think that this way of injecting also takes the risk of this pig in a blanket or artificial look out of the equation, because we're not pushing the skin way out here. If you think about how most providers are using HA filler or hyaluronic acid filler, as that hyaluronic acid filler expands, it's just going to push the skin out farther. When this PMMA process takes place, the inflammation happens, the collagen synthesis starts, the HA or the PMMA filler in here doesn't expand, and it stays contracted against the erectile tissue by the connective tissue barrier. When we combine neurotoxin with the filler appointments, what we're doing with the neurotoxin is we're targeting this muscle back here, because this muscle is what causes most of the penis retraction. So we're trying to block as much retraction afterwards, so you keep this area elongated and then the product lays down more evenly. When we do P shots combined with the PMMA, what we're doing is we're using PRP to feed the fibroblast in these areas. So the P shot does go a little deeper in that deeper plane of injecting with the P shot stimulates the fibroblast in here, and then they have a better response. So the PMMA stimulates collagen formation around it. The fibroblasts are what form that collagen. The PRP feeds the fibroblast. And then the neurotoxin is mostly targeting the muscle here, and that prevents the penis from retracting as much after the procedure. You can inject neurotoxin into the erectile tissue directly. We do that to help guys with erectile dysfunction, to dilate the smooth muscle, bring more blood flow in. But that's not really what we're trying to do with the PMMA injections. So again, just to rephrase the whole thing, when I inject a penis with PMMA, I'm injecting at a deeper level than pretty much everybody else that I see online do. This deeper level usually makes the end result more even, because there's less risk of nodules, there's less risk of irregular formation because this connective tissue barrier that we create on top of it, and it virtually takes out the need for migration. Also, I can inject circumcised guys, non-circumcised guys the same, because the skin's really irrelevant. If you see pictures of guys talking about, this pig in a blanket look, or where it looks like their shaft is outgrown the glands of the penis, it's mostly because their injections are very superficial and done with hyaluronic acid. Hyaluronic acid expands as soon as it gets injected into the body, because it starts to pool in water. We really don't know how much expansion is going to happen. And that expansion is just going to keep pushing that skin out. And if you think about what happens with that, as the skin gets closer to the glands, it gets thinner. So the more it goes this way, the thinner it gets. So this area is going to expand a little bit because of the hair follicles, but this area is going to expand more, and then this area is going to really expand. So these are the pictures where you see almost like an ice cream cone shape of skin expansion. Again, if you maintain a deeper plane of injecting, you take the skin out of the equation, and I think it looks much more natural. So if you have any questions, I have all of this explained on my Youthology Man website, so it's www.youthologyman.com. You can also reach out to me directly. I'm pretty good about answering questions on the boards. I'm also pretty good about answering my DMs. I do have a physician assistant, Krista, at my office that handles most of the phone calls, and then my patient coordinator, Christina, can also help you out. So hope you learned a little bit of something. If you have any questions, feel free to reach out. Again, I'm Dr. Rupeka at Youthology, and thank you for paying attention.